So I wanted to talk and share our story about how the coronavirus has affected us as a business, and being in the care industry, which is obviously like the front line. So when it happened for us, I think that we're actually in quite a fortunate position that our model of home care is quite unique in that we don't do what I call traditional home care, where we've got lots of people that we visit in one day, sort of the 4 calls a day type model. Our model is a minimum call time of 3 hours, or we generally go to someone's home and we're there all day. So from a risk management point of view, that I appreciate would be much better and easier to manage than some of these traditional dom cares that have got lots of carers and lots of clients. So I'd really take my hat off to those providers, I really do. Having managed those block contracts before and being a carer on those block contracts, I really understand the challenges that they will have faced with that, going in and out of people's homes a lot. So the first thing that we had to do was completely restructure our service in terms of carers that were going to certain packages. We tried to contain them just going to certain clients, upped the infection control measures, got hold of the PPE and the cleaning products, and in one package we have carers that literally have a full change of clothes, shoes, the wiped phones, wipe bags, wash the hands, wear masks, you name it. We've gone overboard, and a lot of that is safety, but it's also about reassurance. What I've found is not only our service users, rightly so, that some are very vulnerable, have been really worried about this, but the carers have been really worried as well. And it's about me taking responsibility as a leader and an owner of a care business and saying we've got to take this really seriously for all the people concerned. So our service and our clients come first always, but so do my carers as well. They're also vulnerable. We've had people that have shielded due to personal health conditions that have had to shield. And then what I found is it's been a real challenge around sort of mental health and anxiety. These carers on the front line, they've got family members that they're concerned about. They've got partners that have not been in work. There's been real pressures. So what we've done at the Crescent is we've increased what we've done. We've still done the same and looked after each other, because that's basically our values and attitude. We look after each other. We look after each other's mental health and well-being. We've offered lots of sort of free advice and support. We've got an employee assistance program where we look after our staff, but we've also just shared more sort of conversations and advice that we get through from various different places, reputable places. We've also increased our supervisions, which we do weekly now. We check on people's health and well-being and their families' health and well-being, because we know that has a massive impact on them as well. We've offered support in various different areas. But it's been a real challenge, and for me as a business owner as well, I've got 3 children. My partner was out of work instantly because he's a tradesman. And it's been really tough for everybody. And I think the thing that I'd really like to share is that, as a care service, we have had those challenges. And I think what's been really good is we've pulled together as a team. So I want to say a massive thank you to my team, because they have really shown strength of character and absolute loyalty and commitment to their service users and the rest of the team. So I'll be eternally grateful for that. But also, I just wanted to say that it's okay not to be okay as well. This is a really challenging time. It's a really difficult time. We're all human. And I think the thing that I've taken from this is also just to take one day at a time and just keep getting up, just keep doing what you're doing. Be really kind and look after each other, and just do your best. But also know that people have got their own battles that they're struggling with. As a business, we've come up with different innovative ideas to try and tackle things as we're sort of coming out of lockdown. We've got more wellbeing services planned for people. We've got more events planned when we're allowed to do that. We've also put together a social support service where we can offer employment and opportunities for people that have never worked in care but still absolutely compliance checked and trained and all the rest of it. But it means that we can offer more support to people through social isolation and loneliness, and getting people out and about. We've also put together a creative writing project. So it's a magical letter writing project where we're trying to find things that we can offer people to do, give them purpose and help them get involved in different things and add a bit of magic to people's lives. So we're very busy at the Crescent, still doing what we do, still trying to add sparkle to people's lives. So please watch this space. Thank you.